chapter 24, introduction of viruses that infect humans, the DNA viruses. Okay, viruses and human infection diseases. They're the smallest parasites with the simplest biological structure. They're a protein coat, nucleic acid inside, and something to attach to a cell. That's it. Very simple little guys. DNA or RNA molecules are surrounded by a protein coat. Right? They're obligate parasites. They enter a cell. They instruct its genetics of the cell itself and use the molecular machinery in the cell to produce and release new viruses, because they can't produce new viruses on their own. They have to use a host or cell to do that. All DNA viruses are double-stranded, except for the parvovirus. That's single-stranded. That's what the SS stands for, single-stranded. DS stands for double-stranded. So all your DNA viruses are double-stranded, except for the parvoviruses. Those are single-stranded. All your RNA viruses are single-stranded, except for the double-stranded RNA reoviruses. So most DNA viruses are double-stranded. Most RNA viruses are single-stranded. And there's one exception in each case. These are the different viruses we'll be talking about today. This is a list of different ones. The variola virus, which causes smallpox. Herpes simplex virus 1 and 2, which cause oral herpes, keratitis, and Whipplow's, causing encephalitis in the nervous system, or urogenital, causes genital herpes, the varicella zoster with shingles, and so on. We'll go through all of those today. Epstein-Barr virus, human herpes virus is actually 1 through 8 different types now. The adenoviruses, human papillomaviruses cause warts and genital warts. And then we got JC viruses and the parvoviruses, which is really common in puppies and can be very damaging in dogs in the puppy stage. All right, medical considerations in viral diseases. Viruses are limited to a particular host or cell type. Most DNA viruses are budded off the nucleus. Okay? Most RNA viruses multiply in and release from the cytoplasm. So DNA viruses bud off the nucleus. RNA viruses multiply in the cytoplasm and get released from the cytoplasm. So viral infections range from asymptomatic to mild to life-threatening. They have run the whole gamut. Many viruses are strictly human in origin. Others are zoonosis, transmitted by vectors of other species. Okay. Course of viral disease, the invasion of a portal of entry. They got to get into the body somehow. And that's their primary infection. Once they're in the body, then you can have your secondary infections. Okay, but they have to enter a portal somehow. Some viruses replicate locally, others enter into circulation and infect other tissues where they multiply, like the hepatitis virus, hepatitis B, multiplies exclusively in the liver. After it moves through the bloodstream to the liver, to the hepatocytes. Okay. Common manifestations are rashes, fever, muscle aches, respiratory involvement, swollen lymph nodes. Body defenses, how the body acts against viruses, combined actions of interferon, antibodies, and cytotoxic T cells that can result in lifelong immunity. If the cytotoxic T cells recognize it, then it's stored in the B cells as memory. Many of our infections have rapid courses, which is your lytic cycle, how they complete their cycle in the body. Some establish long-term persistent infections that last many years or even a lifetime. Like talk about hepatitis for living in your nervous system. Okay, it's not seen by the immune system. Okay, so it just stays there, and then it comes out when it becomes active, and it lasts your lifetime. There's 2 types of persistent infections. There's either chronic infections or there's latent infections. Chronic infections are the virus are detectable in tissue samples, multiplies at a slow rate, symptoms usually mild or absent. The latent infection, this after lytic cycle, the virus enters a dormant phase where it just kind of lives somewhere where it's hidden from the body. Generally not detectable, can reactivate and result in recurrent infections. As we talked about before with herpes virus, reactivates with chocolate, sunlight, stress, or peanuts. Those tend to bring it out. Once it's in the latent stage, back out to give you your cold sores or your canker sores. So viral infection, we get penetration of viral nucleic acid. Okay? It has to have that portal. Okay? We can go to the virals multiply, and then the lytic infection can lay dormant, and then it can bud off and release of the virus. It buds off or it lyses. The cell either blows up or buds off from the cell. Okay, once it starts to multiply, become a latent infection. Come here, be latent, and then go back in, and then recurrence. Okay, chronic infection which just persists at a lower state. Okay, or the virus can induce transformation of other cells to form a malignancy, to form a malignant tumor. Those are the ways different. That's how viral infections act. Viral disease. Some persistent viruses are oncogenic, mutagenic, causing cancer, causing malignant tumors to develop. Several viruses can cross the placenta, causing development disturbances and permanent defects in the fetus. This is called a teratogenic. A teratogenic virus is one that affects the unborn child, the fetus. Diagnosis of viral diseases, symptoms, isolation in the cell or animal culture, serological tests we can do for antibodies, and some tests for the different antigens produced by the virus. Okay. For our DNA viruses, animal viruses are categorized according to nucleic acid, DNA or RNA, whether there's a capsid around it protecting it, and the presence or absence of an envelope surrounding it. DNA viruses causing human disease are enveloped DNA viruses, non-enveloped DNA viruses, and non-enveloped single-stranded DNA viruses. DNA virus groups that infect humans. Here's your DNA virus. It could be either enveloped or non-enveloped. Okay, it could be double-stranded. Okay, that's the pox virus. Those are the pox virus, the herpes virus, and the hepatinovirus. Okay, double-stranded can also be the adenovirus or the polyomaviruses or the papillomaviruses. Okay, single-stranded are the parvoviruses. Those are the only DNA viruses that are single-stranded are the parvoviruses. Okay, the pox viruses, those are the enveloped DNA viruses. Those produce eruptive skin pustules, like pox, like the chicken pox. That's what leaves scars on the body afterwards. Largest and most complex animal viruses. They have the largest genome of all viruses. So the largest strands of DNA, the double-stranded DNA. They multiply in the cytoplasm in factory areas. They specify for cytoplasm for epidermal cells and subcutaneous connective tissue. That's where they form pox. They attack the epidermal cells and the subcutaneous cells, the connective tissue. That's where they'll form pox on the outside of the epidermis, outside the skin. Okay, this is the pox virus, the UV envelope. They have a surface tubules. You can see on the outside here, these little tubules. They have an envelope. This envelope surrounds the entire virus. They have an outer membrane, a nucleosome, which is inside the nucleus. They have a core membrane, and they have lateral bodies surrounding the nucleic acids. Okay. Smallpox. Smallpox was the first disease to be eliminated by vaccination, completely wiped out the face of the earth. Exposure through inhalation or skin contact. Infections associated with fever, malaise, prostration, and rash. The variola major is highly virulent, caused toxemia, shock, and intravascular coagulation. Variola minor was less virulent than the variola major. Right? And that's what smallpox can look like. Little pustule granules that occur on it. And when they heal up, they do leave scars. The smallpox vaccine is used as a single drop of vaccina virus punctured into the skin with what's called a double prong needle. So it scars the skin. It doesn't come in like a regular needle. It takes it and scars the skin, and that gets your reaction to the smallpox vaccine. Okay, so it's the only one that has to scar the tissue. And if you've had it, you'll have a scar on your shoulder. Everybody born before 62, 63 has a scar on their shoulder from the smallpox vaccine where they were given that. Routine vaccination ended in 1972, and in the United States in 1972. So I guess it was 72 they stopped doing the vaccine. Vaccine reintroduced in 2002 for some military and medical personnel because they were afraid some people that we were fighting against had actually kept the virus in the laboratory and could release that onto our military. Okay, this is the needle. It's a really weird looking needle. It's a double prong needle, and it causes a scarring on the skin. The scarring causes the inflammation and the reaction against the virus for the immune system to respond. It's the only one I know that you have to scar the tissue to get it to work.
I have a scar on my arm.
Yep, I got one too, my left arm. Yep, where you get smallpox vaccination. Other pox viruses diseases. The molluscule pox virus is much more common pox virus. Causes a skin disease called molluscum contagiosum. Okay. Distributed throughout the world with the highest incidence occurring in certain Pacific islands. It's endemic areas, primary of an infection of children, transmitted by direct contact and fomites. Fomites are things that the virus can live on, can be transmitted like silverware, clothing, utensils, plates, anything that can transfer from one person. The virus can stay there for a little bit and survive temporarily and get transferred to another person. Those are fomites. They're inanimate that can transfer the virus. In the US, it's most commonly a sexually transmitted disease. Okay, the lesions are small, smooth macules in genital areas and in the thighs. AIDS patients suffer atypical forms that attack the skin of the face and forms tumor-like growths. Okay, AIDS patients with a depressed immune system come to a lot of different viruses. Okay, treatment. We use freezing, electric cautery, chemical agents on there. That's for the pustules on the skin. Many mammalian groups host some pox viruses like cowpox, rabbit pox, mouse pox, and elephant pox. Humans are susceptible to only two types. They're susceptible to the monkey pox, they're very similar to us, and the cowpox. Those are ones that we are susceptible to. Monkeypox in humans causes skin pox, fever, swollen lymph nodes. Cowpox in humans is rare, but usually confined to their hands or other cutaneous sites can be involved. Okay, so which of the following is not caused by a pox virus? Musculum contagiosum, smallpox, cowpox, or chickenpox? Musculum contagiosum is, we just talked about that one. Smallpox is the cowpox. Cowpox and monkeypox can transfer. Chickenpox cannot be transferred from the chicken to the human. So the chickenpox are not caused by the pox virus. Chickenpox. Okay. Envelope DNA viruses, like the herpes viruses. All members show latency, okay, and cause recurrent infections. Viral DNA forms episomes. So the virus gets in primarily, you have your primary infection, then it goes latent, and then you get recurrent infections. They can last for weeks to years, or they can last a lifetime. Okay. Clinical complications of latency and recurrent infections become more severe with advancing age. Why? As you get older, your body can fight less infections. So you get reinfected with it, you can't respond to it like you used to. Okay. Cancer, chemotherapy, same thing. You decrease your body's ability to respond to infection. Other conditions that compromise the immune defense, like AIDS. Okay. Anything that depresses your immune response is going to make those recurrent infections more hard to combat. So the herpes virus structure, it's an envelope, isolateral, double-stranded DNA, and it replicates with the nucleus. You can see the envelope around it here. You have the DNA core inside. You have the capsid that surrounds your DNA. And you have these little glycoprotein spikes on the outside where this virus adheres to. So herpes virus, like I said, there's 8 different types now. They keep adding on. Large family members include herpes 1 and 2, herpes simplex 1 and 2. That's a HSV, herpes simplex virus. Fever blisters, okay, are an oral, and then genital infections. Okay. Herpes virus 3 is a varicella zoster virus. The VZV, that's chickenpox and shingles. Chickenpox is your primary exposure. That's what you get as a kid from the varicella virus. Okay. Then you get shingles later on. That's the reinfection of the same virus. That's the varicella zoster. It's called the zoster virus. The same virus, just the primary infection when your kid is chickenpox, then it becomes latent, lives in your immune system, then it comes back out, and it can come out as shingles. That's the zoster virus. Okay, that's your reinfection. Shingles is not a primary infection. It's from the latent virus already being in the body. Herpes 4 is your Epstein-Barr virus, typically associated with like mononucleosis, things like that, where your body just gets very tired. Associated with infection of the lymphoid tissues. Herpes virus 5, the cytomegalovirus, infects the salivary glands, can cause a real severe swelling on the head and neck and the other viscera. 6, 7, and 8, 6 and 7 are roseola, rashes, red rash on the cheeks. Herpes virus 8, KSHV, implicating the Kaposi sarcoma. Now, Kaposi sarcoma is a very rare type of a very dark, very black swelling, usually in the mouth, things like that you can tell, and it's usually only found in AIDS patients. It's very opportunistic, and most people have the immune system that can knock it down. And very diagnostic, you can't miss when you see them. Very large, very dark lesions. Humans are susceptible to 2 varieties of the herpes simplex virus, HSV1, HSV2. Okay. HSV1 is your lesion on the oral pharynx, your cold sores, your fever blisters, your canker sores up in the mouth. It occurs early childhood. I mean, 95% of all kids get primary herpes. I mean, HSV1. Because kids put things in their mouth. They go to preschool, they put them out, they share things, they get transferred very rarely. The primary case is usually a fever. Other than that, just regular cold sores after that. But most kids have them. HSV2, herpes simplex virus 2, there's lesions on the genitalia area and possible in the oral area also. Okay, occurs in the ages 14 to 29. Okay, can be spread without visible lesions. Etymology and comparison of the pathology of herpes 1 and 2. This is herpes simplex 1. This is herpes simplex 2. Okay, this is on the oral cavity or around the, the mouth, and this is in the genital area. Transmission, it's close contact used by the face. And this is sexual or intimate contact for herpes simplex 2. The latency where it lives is in the trigeminal ganglion. So when it comes back out, it follows on the trigeminal nerve, which comes along the branch to the mouth. It also branches up to the eye, but the trigeminal usually branches out on the trigeminal comes across the maxilla and then down the mandibular area. That's your trigeminal area. And this occurs in the sacral ganglia, which is into the genital area. Skin lesions of herpes simplex 1 is on the face. Skin lesions on the external genitalia, your thigh, your buttocks for the herpes simplex 2. Different complications of Whitlow's. Like you can get dentists get Whitlow's herpes a lot of times if they don't wear gloves. They get a virus on the thumb where it usually inhabits. Among obstetricians, your gynecologic personnel is for herpes simplex 2, depending on the area you're working on. Dentists work on the mouth. Obstetricians, gynecologists work in the genital areas. And it can be transferred to your fingers or to your eyes, things like that too. Neonatal encephalitis causes up to 30% of the cases in herpes 1. Causes many cases through contact with the birth canal from the if the mother is positive for herpes simplex 2, it can be transferred to the baby as the baby goes through the birth canal. Okay. So that's some of the reasons for a C-section, to avoid baby going down the birth canal if the mother is positive for herpes simplex 2. All right, transmission by direct exposure to secretions containing the virus. Active lesions are the most significant source. Genital herpes can be transmitted in the absence of lesions. Okay, so the herpes simplex virus 1 is secreted by the lesions. Herpes simplex 2 can be transferred to patient through sexual intercourse without having visible lesions present. Okay. The herpes simplex virus multiplies in the sensory nerves and moves to different ganglia. Like I said, the ganglia for the sacral area is for HSV2. The ganglion for the trigeminal nerve is HSV1. Okay. The HSV1 enters the 5th cranial nerve. That's the trigeminal. Trigeminal is your 5th cranial nerve. Okay. HSV2 enters the lumbosacral spine in the nerve trunk ganglia for the sacral region. Okay. And here's your trigeminal nerve. This is your trigeminal nerve. You have an ocular branch, you have a maxillary branch, and a mandibular branch. And it usually have a mandibular branch, and it occurs along this nerve where you hit your outbreak. You know, base of the tongue, inside the mouth, or up on the upper lips. It's rare to go up into the eye area, but it can. Okay, recurrent infection is triggered by various stimuli. Like we said, a lot of it varies, but they come out mostly as sunlight, stress, chocolate, and peanuts. Those 4 things from just individual people tend to bring those out. It's also kind of a fever can stimulate it, UV radiation can stimulate stress, or mechanical injury. You know, damage to the area responds, the virus come back out in that area. Newly formed viruses migrate to the body surface, producing a local lesion or a membrane lesion. That's your cold sore or canker sore. Children and adults, herpes labialis, or fever blisters or cold sores. Most common HSV1 infections. Herpetic gingival stomatitis on the gingiva on the teeth, especially in young children. Inflammation of the oral mucosa, the gums, the tongue, soft palate, and the lips. Herpetic keratosis, those are your ocular herpes. That's when it grows on the ocular, on the optic branch of the trigeminal nerve. You get inflammation on the eye. Latent viruses travel into the ophthalmic region rather than the mandibular branch or the maxillary branch. Yeah. Okay. Gritty feeling in the eye, conjunctivitis, sharp pain, sensitivity to light. What causes with ocular herpes? Genital herpes, HSV2. Okay, herpes genitalia starts with malaise, anorexia, fever, bilateral swelling and tenderness from the groin, clusters and sensitive vesicles on genitalia, perineum, the buttocks, urethritis, infection region, painful urination that causes, cervicitis, itching, vesicle ulcerations, recurrent bouts, usually less severe. The prime ones is usually the first one's usually the worst. Okay, it's triggered by menstruation in females, stress, concurrent bacterial infections. Okay, and you can see the lesions when they had the breakouts. Herpes is the new one. We talked about that. HSV1, HSV2 infections potentially fatal in the neonatal fetus. That's why they'll do C-section sometimes. If the mother's positive for HSV2 and has active lesions, they'll take the baby by C-section. That way the baby doesn't have to go down the birth canal. They don't go down the birth canal, they're not exposed to the herpes simplex virus, which can be fatal in neonates. Okay, so the infant contaminated by the mother could be before or during birth, hand transmission by mother to infant, infection of the mouth, skin, eye, central nervous system, preventable screening of pregnant women, delivered by C-section. Okay, if there's an outbreak at the time of birth, I'll just do an automatic C-section. And you can see the lesions that can occur. All right, miscellaneous. We talked about herpetic whitlow. That's HSV1, HSV2. Those are with healthcare workers. We get those. That's where we get them with transfer working in that area. Compared to a break in the skin, cause localized infection, usually on a finger or thumb. Extremely painful and itchy. Workers from the field of obstetrics, gynecology, dentistry, respiratory therapy are the greatest risk because they work in the areas around the head and neck, around the mouth, and around the genital areas. HSV1 is encephalitis can cause. That's a rare complication, but it's common in sporadic form of viral encephalitis in the United States, and it is life-threatening. Okay, those are underlying immunodeficiency are prone to severe disseminated herpes. They can't fight the infection as a, quote, healthy person can. That's herpetic whitlow. This is a thumb or finger, I can't tell. But you know, break in the skin, and this gets in there and gets infected, and these are very, very painful lesions. Again, it's transferred by putting your hands in someone's, if your thumb or finger has a break in it, put your hand in the mouth of someone that has active lesions going on, they can be transferred that way. Diagnosis, treatment, control the herpes simplex. Diagnosis. Vesicles and exudate are typical diagnostic symptoms. Okay, scrapings from the base of the lesion show giant cells, which look like on a microscope. They're diagnostic for like cytomegalovirus, things like that. You can easily see it was a form of herpes virus on a slide. Culture and specific tests for diagnosing severe or disseminated HSV, herpes simplex virus. Direct fluorescence antibody tests are also done. Treatment is acyclovir. That's the one most commonly used. Everybody uses for acyclovir. If that doesn't work, then you go with heavy duty ones. The famciclovir, valacyclovir, or topical medications. This is a giant cell. And you can see, these are your normal cells. See them right here? These are all normal cells. This is a giant cell. Let's make it purple. Okay, this whole thing is one cell. And you can see why they call it a giant cell. It's giant and it has lots of nuclei inside of it. Your normal cells usually have one nuclei, the normal size cells. This is a giant cell. This is what you see when you're doing herpes simplex. And it's automatic diagnosis. You can't miss it. I mean, they're huge. They're 10 to 15 times the size of a normal cell. And they got 25 nuclei inside of them. Okay. So herpes simplex 1 usually causes what? And herpes simplex 2 usually causes what? 1 will cause cold sores and 2 causes genital herpes. Fever blisters, yes. Fever blisters, yes, it can. Cold sores, no. Canker sores are caused by number one. Fever blisters, nope, they're caused by number one. Herpes simplex 1 causes fever blisters, cold sores, canker sores, fever blisters. Shingles is the varicella virus and stomatitis. So the only one that makes sense is cold sores, which is in the oral cavity region, oral pharynx, and herpes simplex 2 causes genital herpes in the groin area in your genitalia area. So it would have to be A. The other ones just don't make sense. So herpes simplex 1 usually causes cold sores or fever blisters or canker sores. Okay, or cold sores. Those are all, or fever blisters. All these things here are caused by herpes simplex 1. Herpes simplex 2 causes genital herpes. Okay, the varicella zoster virus. That's the one that causes chickenpox, and then it causes shingles after on a recurrent infections. So the varicella zoster virus is only natural host is humans. Infections are transmitted by respiratory droplets and contact. So the primary infection, we're talking the first infection, is chickenpox. That's your varicella virus. That's your first infection. That's your primary infection. You get the vesicles, the virus enters the neurons, and then once they enter the neurons and the nervous system, it remains latent. It just stays there. When it comes out again, the recurrent infection, the reactivation of the virus, that's your herpes zoster, that's your shingles. So it's the same virus. It's just one's your primary infection, which is your chickenpox. Then your secondary recurrence of it or reactivation of it after the latent stage is your shingles. And it follows these dermatomes. Okay, more common in older patients because the virus lays there. And it gets more and more, the host becomes more and more immunocompromised as you get older, and then it can come out. Dermatomes are areas where nerves innervate certain sections of the skin. In other words, you got certain areas where nerves innervate, and those are called dermatomes. They're little areas. So that's where the virus comes out, along where these branches of nerves come into. And this is chickenpox. That's common with a lot of kids. Everybody sees it. Okay. This is the herpes zoster virus. It sits in the ganglion. And your dorsal root ganglion, then you got your ventral root, your spinal cord coming in here, and it sits up in here. And when it becomes active, it follows that nerve along those ends, and it innervates what's called those dermatomes. See, the nerve branches to a certain area. This is an area of a dermatome supplied by a nerve tract. The virus travels along that nerve tract and expresses itself along where that nerve is. So you can get shingles any place on the body as long as it follows that nerve tract, depending where in the spinal column this virus is living in the ganglia. And that's shingles. And you can see it's a path. Here's the dermatome. It's this area is supplied by one branch of the nervous system. It doesn't spread this direction because nerves run this way across the body. So you can see how it's spread in just this area. Okay, that's what the herpes zoster virus looks like when it's the shingles, when it forms shingles. They'll form along a band strip like a dermatome. They will not form up and down. Okay. Diagnosis, treatment, and control of the varicella virus. Its diagnosis, cutaneous manifestations of varicella, and shingles is a physical characteristic for ready clinical recognition. Shingles are confirmed by multinucleate giant cells. Okay, remember we saw those. They're easy to define. In stained smear prepared for vesicle scrapings, they're unequivocal shingles identification with fluorescent antibody detection of the viral antigen in skin lesions, or DNA typing, or culture. It's how we diagnose the virus. Treatment symptoms and uncomplicated infections. Acyclovir, that's always our first go-to drug for viral infections, acyclovir. Famciclovir is after that, or interferon for systemic disease for spread. We have a live attenuated vaccine called Varivax for chickenpox and for shingles. The cytomegalovirus, okay, these produce giant cells also. They produce giant cells with nuclear and cytoplasmic inclusion, just as we saw in that slide. It's transmitted in saliva, respiratory mucus, milk, urine, semen, and cervical secretions. It's commonly latent in various tissues, just like all the herpes viruses are. Most infections are asymptomatic, don't even know you have it. There's 3 groups of more violent from the disease. for fetuses, newborns, and immunodeficient adults. Patients that have their immune system compromised. That's when the cytomegalovirus becomes deadly. Okay. Again, here's your normal lung cell. This is the large giant cell. And this huge nucleus, other nucleus, multinucleated in there, and includes inside the nucleus. Okay. So you can see your giant cells in there too. So the cytomegalovirus, newborns may exhibit enlarged liver and spleens. Then you have jaundice, yellowing of the skin. Okay, they're not getting, the red blood cells are being destroyed. Okay, and they're producing bilirubin. The bilirubin is going out of the cerebrum, and that's causing this yellow coloration of the skin. Capillary bleeding, microcephaly, ocular inflammation, and it may be fatal in newborns. So most of the cytomegalovirus, I don't know you've got it, except newborns, fetuses, and immunocompromised patients. Babies who survive the cytomegalovirus can develop neurological problems, hearing, visual problems, and mental retardation. Perinatal cytomegalovirus infections mostly are asymptomatic or pneumonitis and mononucleotide-like symptoms. It produces like the Epstein-Barr virus does. AIDS patients, the cytomegalovirus, mononucleosis, disseminated cytomegalovirus, and retinitis. Again, AIDS patients have a depressed immune system or a compromised immune system. Transplant patients can get pneumonitis from it, hepatitis, myocarditis, and meningoencephalitis. Treatment is reserved for immunocompromised patients. Okay. The Epstein-Barr virus, okay, ubiquitous virus, infects lymphoid tissue and your salivary glands. It's direct oral contact and contamination with saliva. So direct oral contacts cause the kissing disease, mononucleosis. Okay. Industrial countries, college population is vulnerable to infectious mononucleosis, which is your kissing disease. By midlife, 90 to 95% of all people are infected with the Epstein-Barr virus. Anyone with immune deficiency is highly susceptible to it. Most average, quote, healthy people that are not immune deficient, it doesn't affect them. You have immune deficiency, then it becomes a problem. Infectious mononucleosis, you get sore throat, high fever, cervical lymphadenopathy, develops after 30 to 50 days incubation. Dormancy in your B cells get reactivated, and it may be asymptomatic. And this is what, look, this is your tonsil area. You can see the inflammation, which is your red area here, and you can see the exudate of the tonsil being produced in the tonsillar pads. Okay, very distinct when you look in the patient's mouth. Okay, you get tumors, other complications associated with the Epstein-Barr virus. You can get what's called Burkitt's lymphoma, which is a B cell malignancy. Usually develops in the jaw. You get very swollen cheeks, huge swollen cheeks. Just like with mononucleosis, you get the swollen cheeks like the mumps. Okay, that's what you get with mononucleosis, that's the Epstein-Barr virus. It can be a lot greater than the mumps, bigger swelling. Okay, affects the Central African children, 48 years old, may be associated with chronic co-infections with malaria and other types of diseases. The nasopharyngeal carcinoma, so you get Burkitt's lymphoma and nasopharyngeal carcinoma, which malignancy of the epithelial cells. This affects older Chinese and African men. And you can see the distortion of the cheeks there. So those are two other complications with the Epstein-Barr virus. Diagnosis, okay? Differential blood count shows lymphocytosis, neutropenia, and large atypical lymphocytes. It affects your white blood cells. Serological assays to detect antibodies and the antigen for it. Treatment, directed at relief of symptoms or fever and sore throat, and let it heal on its own. Disseminated disease may be treated with IV gamma globulins, interferons, acyclovir, and monoclonal antibodies. These are in patients with compromised immune systems. Okay. You can see this is normal lymphocytes. These are your blood cells on the side, but you can see how the granular material in the nucleus takes up most of the cell. And you can see here, all this extra part of the cell here. These are your lymphocytes affected with Epstein-Barr virus. Okay, the 6, 7, and 8 now. Human herpes virus 6, 7, 8. On number 6, the human B lymphotropic virus, transmitted by close contact with saliva and secretion, and it's very common. It causes rosolia. Rosolia is a rash, a red rash that you get usually on the cheeks. Acute febrile disease in babies 2 to 12 months. Begins with a fever, followed by a faint maculopapular rash. Usually it's self-limiting. Adults may get mono-like symptoms, lymphadenopathy, and hepatitis. Over 70% of MS patients show signs of the infection of herpes simplex, herpes virus number 6. You can see the rash, the rosette color of it along the belly there. You can see some along the arms here too. Clinical study has shown relationship between herpes virus 6 and Hodgkin's lymphoma, oral carcinomas, and certain T-cell leukemias. Herpes virus 7 is closely related to this virus 6, and it causes similar diseases. Number 8 is Kaposi sarcoma, okay, common tumors of AIDS patients. Most of the time you see a Kaposi sarcoma in someone's mouth. It's a big, very dark black lesion, and they can be, I mean, 10 millimeters in diameter, you know, large lesions. That's almost diagnostic of an AIDS patient, or someone has a compromised immune system. Also may be involved in multiple myeloma. Okay. Next question. Varicella and herpes zoster are caused by what? The same virus, 2 different strains of the VZV, or the herpes simplex virus and herpes zoster virus, or the cytomegalovirus and the variola zoster virus. Which one would it be?
Is it C?
Nope. Remember, varicella is chickenpox. That's what it causes. That's the primary infection. And then herpes zoster is shingles. Okay. The primary infection is a chickenpox. The reinfection is the same virus, and it causes shingles.
Oh, A.
It's the same virus. It's just the primary infection is chickenpox. Once it lives latently in the body, comes out and recurs, then it's shingles. It causes shingles. So it is the same virus. That's on your nursing exams too. Varicella and herpes zoster are caused by the same virus. Just one's primary, one is the recurrent infection. Make sense?
Yes.
All right, perfect. All right, hepatitis. Hepatitis is an inflammatory disease of liver cells, may result from infection by different types of viruses. It interferes with the liver excretion of bile pigments. Bilirubin accumulates in the blood from the broken down red blood cells, okay, and it causes jaundice. This is yellow tinge to your skin and in your eyes, you can see it. Viruses involved in hepatitis. You have all, there's HIJ, there's all kinds nowadays. They've made so many different new viruses for the hepatitis virus. So the DNA viruses are hepatinoviruses, is the major group of them. This is a hepatitis B virus, produced hepatitis in humans. The RNA viruses, A, is from contaminated food. It's the least virulent kind, self-containing. Hepatitis C is from blood, like blood transfusions. Hepatitis E, from fecally contaminated food, causes similar disease to hepatitis A. And hepatitis D, it's a defective RNA virus, only infects cells already infected with hepatitis B virus. Okay, so hepatitis A, hepatitis B, hepatitis C. Okay, these are RNA, and hepatitis B is DNA. That's the hardy one. That's one that's really hard to kill. You can do a cell culture for A, but you cannot for B and C. They're enveloped. They have an envelope surrounding it. Hepatitis A does not. Hepatitis B and hepatitis C does have envelopes around it. These are chronic carriers you have for B and C. Active infections are for hepatitis A. The transmissions by oral, fecal, water, or food for hepatitis A. B is contact. Not up here, please. No, I'll come down. I won't need you. Thank you, Bill. Contact with blood or serum, sexual and intimate contact with hepatitis B. Contact with blood serum is hepatitis C. Different incubation periods. And their symptoms. Okay. Fever, GI disorder for A. Fever, rash, arthritis for B. And similar to B is hepatitis C. Jaundice occurs only 1 in 10 for hepatitis A, so not very common. It's common with B and C. Treats complications and different incidences. The vaccine, you have a vaccine for A, vaccine for B. There's no vaccine for hepatitis C. Test to differentiate, all three have tests that will differentiate the 3 types of hepatitis. So hepatinoviruses are envelope DNA viruses. Okay? They've never been grown in tissue or culture. Their unusual genome contains both double and single-stranded DNA. It contains both. It's a tropism for the liver. It gets in the liver and it takes over and it controls which way the liver develops. It causes the disease to occur through the liver, whether it's cirrhosis or malignancies, whatever in the liver. Hepatitis B multiplies exclusively in the liver. Okay, that's what it affects. Goes into the, once it enters the body, it goes into the bloodstream and it affects the hepatic cells, okay, which continues to seize blood with virus, and it is a chronic disease. There's 170 virons per milliliter of blood. The minute amount of blood, okay, blood products can transmit infection. It can be sexually transmitted. It's a high incidence among homosexuals and drug addicts. Transmission of hepatitis B increases risk of liver cancer, hepatocellular carcinoma. And these are different things. Dane particles are the particles associated with hepatitis B. It's a small condensed particle that you see in the liver. You get a filament form and you get the envelope ones that you can see that surrounding the little spores. Pathogenesis. Virus enters through a break in the skin or mucous membrane or by injection into the bloodstream. It reaches the liver cells, multiplies, and releases the virus into the blood. It gets in the blood, goes back to the liver cells, and keeps it in the liver. Average 7 weeks in incubation. Most exhibit few overt symptoms and eventually develop HIV immunity. Some patients have experience malaise, fever, chills, anorexia, abdominal discomfort, and diarrhea. You get fever, jaundice, rash, arthritis in the more severe cases of it, and a small number develop chronic liver disease, necrosis of the liver or cirrhosis of the liver. Diagnosis. It examines your risk factors. Also, serological tests. Check the blood for the detection of antibodies and antigens, radioimmunoassays, or the ELISA test for surface antigens. Screening of blood for transfusion, semen for sperm banks, organs from transplants, routine perinatal testing of all pregnant women. These ways we diagnose and keep track of hepatitis B. Mild cases managed by treatment of symptoms and supportive care. Chronic infections are treated with interferon. Okay. Prevention of hepatitis B. Passive immunization with HBIG for persons exposed or possibly exposed include neonates born to infected mothers. We talked about before. It can be transferred, baby goes down the birth canal. Vaccines derived from surface antigens from cloned yeast. There's 3 doses, you do 3 initial doses, and then there's a booster shot with it. We do the vaccine. Vaccines derived from pure sterile antigen extracted from carrier's blood. That's many people who have a yeast allergy. You can't grow yeast with the yeast allergy. Let's do it directly from extracted carrier's blood. So non-envelope DNA viruses are your adenoviruses, your papillomaviruses, your polyomaviruses, and your parvoviruses. Adenoviruses are non-enveloped double-stranded DNA. 30 types associated with human disease. Oncogenic only in animals. It does not cause cancer in humans. These adenoviruses only in animals. Okay. Infected lymphoid tissue, respiratory, intestinal, epithelial, and the conjunctiva. That's where it's located. It's spread by respiratory and ocular secretions. Causes cold, pharyngitis, conjunctivitis, keratoconjunctivitis, and acute hemorrhagic cystitis. Severe cases are treated with interferon again and inactivated polyvalent vaccines. Okay, that is the adenovirus. Papilloma and polyomaviruses. They're small, non-enveloped, double-stranded DNA. They're circular DNA, and they can cause persistent infections and tumors. The papillomavirus is a squamous epithelial growth, causes a wart or verruca. Okay, it's just a wart-like appearance that appears on the surface of the epithelium. Thanks. Caused by 100 different strains, okay, of the human papillomavirus. Transmissible through direct or contaminated fomites. Fomites, again, are inanimate objects that can cause transfer, like silverware, utensils, dishes, clothing that the virus can live on and be transferred from one person to another. Incubation period, about 2 weeks to more than a year. Most common warts regress over time. They can be removed by chemical application of podophyllin, physical removal by cauterization, freezing it, you can use, or laser surgery. And then the warts have a real high reoccurrence rate. It can reoccur. Okay, if you have a common seed warts, they're painless, elevated, they're rough growths on the finger. You get them on the fingers, you can get them in the genital areas. So the common seed warts are on your hands. The plantar warts are deep, painful on the soles of your feet. And then genital warts are the most common sexual trinity in the United States. Morphology ranges from these tiny, flat, inconspicuous bumps to extensive branching like a cauliflower mass on the papillomatovirus warts. And you can see warts on the fingers or warts in the genital area. You can see all the warts growing to the sides here. So the human papillomavirus, there's 9 human papillomavirus types, increased risk for developing reproductive cancers. There's 2 account for 70% of the metastatic tumors. Early detection through inspection of the genitals, women's pap smears, screen for abnormal cervical cells to prevent cancer developing from these papillomaviruses. There's 3 effective vaccines for it. They've been approved by the FDA, Cervarix, Gardasil, and Gardasil 9. Okay, that's good. These are your normal cervical cells. This is a pap smear. You use scraping, that's your normal cells. And you can see he's like popped out different. They almost look like a fluid-filled sac rather than a cell. They don't come out flat in their appearances. They're easily distinguished by a pap smear. So a patient complains of feeling tired and achy. You notice a pale rash on the patient's chest and yellowish skin tone. What is the likely infectious agent? Cytomegalovirus, hepatitis B, Epstein-Barr, adenovirus. Okay, only one of those, you might get a rash with several, but only one of them is going to cause a yellowish skin tone. Yellow skin tone is jaundice. Jaundice you see with hepatitis B. You see that with jaundice. Okay, the cytomegalovirus, it can cause a rash, but a yellowish skin tone occurs in the skin and in the eyes. That's from the bilirubin being broken down in the liver from the hepatitis B infection in the liver. Okay, so once you see yellowish skin tone or yellowish discoloration in the eyes, you know that's a pretty good idea it's hepatitis B. Okay. Polyomaviruses, those induce tumors in experimental animals, those are JC and BK viruses. Those are the most important human polyomaviruses. They're common throughout the world. Majority of infections are asymptomatic. Okay. The progressive multifocal leukoencephalopathy is an uncommon fatal infection by JC. So they can be common infection, but that's very rare. The BK infection is renal transplants, causes complications in urinary function. We do those. Those are uncommon viruses. Okay. The parvoviruses, if you've ever had a puppy or a little dog, they're not supposed to take it out for the first, I want to say 7 weeks, 8 weeks, 9 weeks, because the parvovirus, they affect dogs. Not very common in people. They're not very virulent in people. It's not an envelope. It's a single-stranded DNA. This is one of the few exceptions to your double-stranded DNA. It's a single-stranded DNA virus. Small diameter, genome size very small, causes distemper in cats, enteric disease in dogs, and fatal cardiac infections in puppies. Okay, and it's spread through feces of other dogs. Few causes infections are in humans, but you get their dogs your parvo shots and you keep them isolated for, I think it's 6 or 7 weeks when you first get your puppy. The human parvoviruses is B19, causes erythema infectiosum. Sounds like a Harry Potter spell, right? Erythema infectiosum. This reminds me of, it's the 5th disease. It's a rash of childhood. Children may have fever and rash on their cheeks. This is B19. Severe fatal anemia can result if pregnant women transmit the virus to the fetus, can damage red blood cells. Adeno-associated viruses, the defective virus, cannot replicate in the host cell without the adenovirus being present. And you can see the roseola, the redness of the cheeks.